So far, we've discussed acute PID and we've established that it's normally caused by sexually transmitted infections. Now I'm going to move on to discussing chronic PID. And I'll start by discussing the most common cause of chronic PID in our country, which is TB. So, in approximately 9% of cases of extrapulmonary TB are of the genital tract. So it's actually quite common, and I think it's probably quite underdiagnosed in our country. It's spread hematogenously or by lymph node spread. We'll talk about the symptoms of chronic genital tract TB a bit later. What are other causes of chronic PID? Schistosomiasis can cause a chronic PID picture, especially in areas like Mpumalanga and Limpopo. And then another rare cause of chronic PID is actinomycosis. That's a fairly rare bacteria, which often causes abscesses on the skin, but in the case of genital tract PID, it's normally associated with long-term indwelling IUD use. It's very, very rare, but just so that you know about it, it's called actinomycosis, and it's an anaerobic bacteria. And then the last cause of chronic PID that I'm going to mention is chlamydia. I think we've already mentioned that it can cause a subclinical infection, which is often only diagnosed as infertility later. So let's go through the symptoms of chronic PID. It can be pretty insidious. It may have a low-grade fever. There may be weight loss associated, abdominal pain and dyspareunia, and then, as we've mentioned, infertility is a common cause of chronic PID and also of acute PID because of the associated tubal damage. So now we've discussed acute and chronic PID, and that brings us to the end of the presentation. Thank you very much.